Good morning. I think I'm live. I'll just wait for a minute or two, or maybe less than a minute or two, to see if anybody wants to join, and then we'll get going with today's Talking Cafe, which is ADHD Awareness, as it's ADHD Awareness Month. And I have loads of information today, and I might look a little bit like a newsreader because I normally do a PowerPoint slide and then I can click and see what to say, but because I'm doing it on my laptop, I'm not smart enough to fathom how to do the both at the same time. So I'm going to be like a newsreader and shuffle my papers that I have prepared, and I'll probably be flicking back and forth to make sure that I've got everything that I want to say. Morning, Julie. Because it is such a huge topic, isn't it, ADHD? I mean, I couldn't possibly fit in all there was to say in 45 minutes. There's so much information, and yeah, so hopefully I'll do it justice today for those people that are wanting more information about it, or perhaps they have a child that they're concerned. I'm trying to not say worried or concerned or things like that, because, or not normal, because it isn't. You know, for you as a parent, it is your child, isn't it? So that means that your child, or you as an adult suffering, you are a normal person. Everybody is human, is normal, aren't they? You know, it's just fitting into social. What am I trying to say? Fitting into the social aspects of everything, isn't it? And what other people do and that sort of thing. And I myself, well, us as a family, I have a daughter who is undiagnosed with ADHD. She's just 7, so it's been a long road for us, and it's only recently that I've actually felt as though we are being heard. And because I do appreciate, before, you know, becoming 7 and onwards, it's very, very difficult to diagnose. I mean, in girls anyway, it's very difficult to diagnose. So they obviously they want to give the child the opportunity to grow a little bit more and learn things. So it's something that I'm learning about all of the time, and I have a really good book that my husband and I have been reading for the past 18 months, and it has really, really good tips on how to manage different behaviours and things. So it's called Step-by-Step Help for Children with Autism, and a self-help manual for parents. So it goes through, obviously, the traits and the symptoms and things like that, and then it gives you sort of a step-by-step guidance and different plans. So like a diary for difficult days, planning for times ahead. Because I was reading yesterday, which is something new to me as well, is that children with ADHD can have good weeks and bad weeks, which would make sense, wouldn't it? Because we all have good weeks and bad weeks. So I think as my daughter's been getting older, her symptoms have changed a little bit. Her tantrums, obviously, now that she's coming up to 8 in April, they have changed a lot from being a toddler and having, you know, the generic toddler tantrums and things like that. So it's about managing it, getting different strategies to manage those, really. And obviously everything what's in this book wouldn't apply to my daughter, but it, you know, there are tips and things in there that we would take from it, because what she does would be totally different to what another child suffering with ADHD would display. So it's about knowing your child and knowing what their triggers are and how to manage them, knowing when to give them space and when to give them you know, comfort and things like that, because all those things play such a big part of managing a child with ADHD. And it has been so difficult because she was our first daughter, and I have another daughter who's just turned 5, and as my younger daughter was growing up, it was more clear to us that she was progressing further with her social skills and her, you know, ability to be able to dress herself and take instructions and things like that. And I kind of was thinking, is it us? As you know, are we doing something wrong? And it's been really good that we have had the support of our family, and I'm very lucky to have a sister who is a children's mental health nurse. So I've obviously had lots and lots of conversations with her, and the school that my daughter goes to, they have a brilliant Senko there, and the school teachers, we've had regular meetings to be able to discuss my daughter's developments and her strengths and things like that, and then sort of put in a plan of what we hope to achieve for my daughter throughout her schooling. Because for us, it's about being able to support her to achieve everything that she can be. It's very difficult as a parent, because you don't want to give your child a label. You don't want to put them into that box and say, oh, you know, this is an excuse for all their behaviour. It's not about that for us at all. It's about learning. I'd say to the Senko, I don't want to keep telling her off if it's, you know, for something that she doesn't understand. Because it's not doing any good for anybody. It's causing my husband and I stress and anxiety. It's not getting through to our daughter. How can we change? What can we change to be able to get her to understand things better? One key thing for us was strangers. It was so difficult for us to get through to her that it's not okay to talk to strangers. You know, we could be in a supermarket and she would, you know, there'd be a little old lady or something would say, oh, hello, and start chatting. Well, my daughter would tell her whole name, her age, where we lived, how old we were. And no matter if we stopped and said, you know, come on, you mustn't talk to strangers, you can't do that. And we try and explain to her why, you know, we don't talk to people that we don't know. It was really difficult for her to understand that. So her way was to then talk to strangers and say, she would tell them that she shouldn't be talking to strangers. So that was the main worry for us. But this was probably going back to when she was 5, and we were really concerned that we wanted to teach a stranger danger. We wanted to protect her and things, but we couldn't get it through to her. So we wanted the support of the professionals to be able to guide us with how we can change that. So with her having extra support from school, so they concentrated a lot on stranger danger and other social skills like that. And then obviously we were reinforcing that at home. So it was about creating a plan between us at home and our family and school to be able to teach her, you know, what in a way that she could understand what we, you know, what the bigger goal, which was her safety. And that's just one aspect of having a child with ADHD. There's so many other symptoms, but that was the main concern for us. So this I can't recommend this book enough. It's step-by-step help for children with ADHD, a self-help manual for parents. And, you know, I haven't read it from start to finish, but I've read the first bit and then I've sort of been flicking through to see, because it's quite difficult to retain all that information and apply it at that time when it's relevant. So, you know, it's on my bedside table at night and I'll be looking through it and see different things. Like I've just come across now a page about timers. So, and I think for anybody with a child full stop, getting them out to school on time in the morning is a nightmare. And I've got friends who swear by putting a timer on their Alexas or their smart speakers or whatever on their phones to say, you know, set the timer for 5 minutes, and by this time they need to have put their shoes on. They need to be ready for 8:15. They need to be leaving the house for 8:25, and they absolutely swear by it. So I think that's a really, really good tip. And actually, that was a tip that my daughter taught us, because if we asked her to do something like eat her dinner or tidy up her room or something like that, she'd want to know, she'd want a timer to be able to, I suppose, guide her to how much time she's got, and she can be a bit cheeky and say, she's not so bad at it now, but with eating, it'll be, if she wants to eat it, it'll be gone, and you know, there's no qualms about it. She's a pretty good eater. She's a huge appetite, which is another symptom of ADHD in girls, which I hadn't realised until recently. But if it's something that she doesn't want to eat, she'll ask you how many mouthfuls you want her to eat and things like that. So it's so interesting to try and learn about the subject and you know, keep yourself up to date with how you can manage, really. Otherwise, I think you just, you know, the nights, the days, the times that I've spent in tears because I just feel like I was at my wit's end, because I did, you know, if I had a particular bad day or a bad week, or I felt I couldn't get through to her, or, you know, and everything just seemed so stressful. She was obviously feeding off the fact that I was anxious and stressed about it, and it's just like that whole vicious circle. So I think, you know, definitely doing research into it and liaising with the school, the health professionals, GPs, and health visitors. I think my daughter's a bit old now for the health visitors, but if your child is younger than 5, then that obviously applies to you. So yeah, that's just a little bit about me, really, and my personal circumstances, because it's important to me to be able to raise awareness for ADHD, because it's affecting me personally. So when I was asked to do a topic for this month, and it was made aware to me that it is ADHD awareness, it seemed right to me that I, as an agent who has personal experience with it, could deliver something that I felt would benefit parents and adults too, because obviously, you know, you can go half your life without being diagnosed with it, but then actually something might, you know, you might have had problems. I know there's a lady I follow on Instagram. She's quite funny. She's the hot cross mum, and she's if you're offended by strong language and things, she's probably not for you. But more recently in lockdown, she has come forward and said that she has recently been diagnosed with ADHD. And I was just going to read a little bit about what she had written, which was going through school with both undiagnosed ADHD and dyslexia was awful. Sitting a 3-hour exam with your chair feeling like lava, watching the questions merge, looking back, feeling inhumane, when no one would agree to put their name on her UCAS form as they deemed her not intelligent enough to go to university. She had to ask a neighbour. And she has written a quote from Shakespeare, which has stuck with her for years. That's, "The greatest strength is your great weakness." And she's tried her best to be normal. And she can't begin to explain the strength it would take to make it to her desk in the morning. So when 5 p.m. on Friday rolls around, I've deteriorated to the point where I've come to the weekend and I can't do much. She's choosing to tell everyone and ask for you all to accept her, so she can be honest and a bit more eccentric. You are not a coping mechanism, and if you have anyone close to you displaying bizarre behaviour, understand it's part of a bigger picture that you may not know about. And she goes on to thank her husband, who had obviously seen her struggling and connected the dots, and she obviously went to the GP, and she's a big advocate for a medication that she's now on, which helps her focus on her daily tasks and achieve them, which is what it's all about, really, isn't it? So to say, I wanted to read something from theycallmemummy.com, and it is. It's, imagine while we are talking that you have 5 children yanking on your arm and calling your name. Someone's brewing coffee through a loudspeaker that's aimed at your ear. A Chinese dragon is dancing around the room and weaving in between us. A song comes on the radio, and immediately a childhood friend you haven't seen in 15 years materializes out of thin air and demands that you reminisce, and then 2 of the kids start pulling each other's hair and 1 kid vomits. Now, don't notice any of this and continue talking to me. Focus only on what I'm saying. It's not easy. Welcome to the brain of someone with ADHD. And it's just, when I saw that, it really made me quite emotional, and I'm surprised I've not been able to get through that, because it's you know, for me, it's imagining what life is like for my daughter, and it's hard for you as a mother, because you want to change that, and a father, sorry, you don't want them to struggle, and you don't want them to feel anxious and stressed and things like that. So it was really difficult but interesting to read what life is like for her inside her mind. And often she'll give you little snippets of what it's like for her. So these are things that we think are quite quirky about her and funny. So she struggles with food. So she can eat an awful lot of food, and she hasn't got the ability to stop. So it has to be removed from her, and because she can eat and eat and eat until she is sick. And we'd say to her, she could say, "Oh, I feel sick." We'd say, "That's enough now. That's your body telling you, you know, you've missed the signs that I've said you're full, and now your body's saying that is enough." And she would say to us, "But my brain is telling me that I need to keep eating it, but my tummy is telling me that that's enough." So it's like she's telling us that there's this battle between her brain and her tummy, and she doesn't know what to do. And that's us intervening then, and we would just remove it and say, you know, that's enough. But she misses it's important for us to sit down and have meals together so we can monitor that and how much is on her plate, because if you left food in the kitchen, for example, pasta is the worst. And I make pasta for the whole street, so if there's some pasta left, she will continue to go back and eat it, and we have to remove it. Otherwise, you know, she just gets to a point where she's vomiting. Obviously, it's really important that we need to monitor her weight and things like that. So, which during lockdown, I had a meeting with the Senko via Teams, and it was interesting to me that is a symptom of ADHD, is like the inability to control how much you can eat, because it's like an impulse, isn't it? It's like it's there. You have to consume it. It was really odd to us, because we just thought, oh, she's got a really good appetite, and she's just a general kid. She doesn't know when to stop snacking. So that was quite interesting to learn about as well. Lucy, my brain says eat and my tummy says no. Yeah. Oh, thanks, Lucy. So, attention deficit hyperactivity disorder, ADHD for short, is one of the most common conditions diagnosed in children, and it's a neurodevelopmental disorder that causes various hyperactive and disruptive behaviours. I think years ago it was given the label of being a naughty child, wasn't it? And it isn't that at all. It's you know, it's what I've been talking about, and today I hope to, if you are of the opinion that is what it is, I hope that this will educate you a little bit more and be able to understand what life is like for somebody with ADHD. So it's difficulty focusing, sitting still, staying organised. Children will show signs before they're 7, but it's highly unlikely that they would be given a diagnosis. So for my daughter, she's 8 in April, and the waiting list is so long to be referred to CAMHS and get a diagnosis. And in my mind, I was thinking, if all I really wanted was to have some guidance, I'm not really bothered if she's diagnosed with it or not. So I'd, if all I want is to learn how to connect with, how to manage, how to guide her through her early life so that she can achieve everything that she wants to achieve. But when I was talking to the professionals and my sister, it's not really, I was looking at it like what I wanted, but it's not about that. As she gets older and she is becoming more aware of her disorder, it's about her understanding it and what is right for her. So when we were talking about medication, I immediately said, no, I'm not going to medicate my child so that I can cope with her, because that's not what I want at all. But then looking at it from a Senko's perspective, who said, well, actually, your daughter's not at that, you might feel that she's not at that stage now, but we do have children who have been able to sit on a chair. They would sit underneath a table and not do any schoolwork at all. Once they'd had the medication, it meant that they could sit on their chair and they could participate in the class. So that's the goal, isn't it? Is that your child is able to learn. So I was thinking of it as no, I don't want to medicate her because it makes me feel as though I'm doing it because I can't cope with it, which isn't the same case at all. But it's not about that. It's about your child and what they need and what is suitable for them, which has been, part of our growth really as parents, and what our daughter needs. It can remain undiagnosed into adulthood, and it usually is. It probably runs in the family, and in our family, there are probably people that are undiagnosed with it, and I know in my sort of like cousins and things like that, their children have it too, and every child is different, as every child is. I have 2 daughters. Each of them have totally different personalities, and it is the same with ADHD in girls and in boys. It differs so much. Boys are 3 times more likely to receive an ADHD diagnosis than girls, because it presents differently in girls. So boys usually will show internalized symptoms. They'll be running around, impulsivity, can be physically aggressive, but girls will show it internally. So inattentiveness, low self-esteem, verbally aggressive, which leads me on to sort of like how it's different in girls. They display fewer behavioural problems, which are less noticeable symptoms, and because of that, their difficulties are often overlooked, and they don't get the referral that they need, which can lead to additional problems in the future and impacting self-esteem, mental health. I can't even read my own notes here. That's awful. So it's increased risk of depression, anxiety, eating disorders, and pain and anger. Inwards, which we see a lot with our daughter. If she can't cope with anything that she's going through, really, then she won't shout verbal things to us, sort of like she hates us or anything like that. But what she will say is, to herself. She directs everything to herself. So I'm terrible. I shouldn't have done that to my sister. Now I've gone to bed early. I've ruined it for myself. Those things, which then we will intervene and have to sit and make sure that the environment is it's not, there's not lights on, radio, TV, music, that sort of thing. It's generally in her bedroom, just myself and her, or my husband and myself and her, and we can have a calm discussion. We have to try and get her to focus on hers. Breathing techniques. We do something that we've learned, which is, it's called a butterfly technique, which you cross your arms over, and it's about regulating your breathing. So it's like patting like this, and it helps to sort of bring her around, calm her down. Then we can have a discussion about why this incident has occurred, how we're going to manage it, what we're going to learn going forward. And so that's really, something that we've had to learn with her, because it's that's the way that she is, and that's totally different to my other daughter who's younger. We can manage her tantrums and her misbehaviors differently. If you're going later on in life and you don't get the diagnosis and you don't get the help and the treatment and to learn to manage, the way that you are, then it does, you can get problems in school, social settings, relationships and things, and so on and so forth, which, going back to saying that I didn't care if she didn't get a diagnosis because I didn't want to label her. Well, actually, if we didn't give her that, she wouldn't be entitled to the help and support that she so desperately needs to achieve all her goals in life, and to make her aware of, actually, if we didn't go down that route at all and we tried to sort of say, oh, you don't, there's nothing wrong, and then later in life she has mental health problems, relationship problems, these are all things that we could have spent her whole early years teaching her about, so that when she's older, she knows a hell of a lot more, and we've spent all that time giving her the tools to flourish in adulthood, which is the achievement. It's the goal that we want for her, for us, and for her, really. So I can't reiterate enough how to try and look at it from your child's point of view rather than yourself. And it is so difficult. It's so difficult because as parents, you're your worst critic. You worry about things that actually they're not that important, what so and so down the road thinks. It doesn't matter. But yeah, at that time it does, doesn't it? You think, oh, maybe the school mums might think, oh, I just it's because I can't manage her, and it's not that at all. So don't be your own worst critic, really, and try and focus on facts and the help and the support which is out there, because it wasn't, it's only recently really that we do have so many professionals that are so aware of all these autism, ADHD, all everything on the spectrum, which is great. But it's really, So as I said, it differs from boys to girls, which is why it's really difficult to get a diagnosis for a girl. So girls will be withdrawn, boys will have impulsivity and acting out. Girls will have low self-esteem, boys will have hyperactivity, running and hitting. Girls will have anxiety, boys will have lack of focus. Girls will have intellectual impairments, and the boys will have inability to sit still. The list is I think it's basically saying that boys are sort of more flamboyant with it. You can notice it more, whereas girls, you think, going back to the Senko that we see at school, when I first started to raise issues and say, you know, we are struggling, but there was nothing sort of concrete. I couldn't say she wasn't developing, because she is developing, and she has been, but it was hard to say just exactly what I wanted to say, because I couldn't explain it, because it wasn't like she was unbearable and totally difficult to manage, but there were things that just didn't seem right. And so I spoke to the Senko and I said, look, you know, I've got this and this that I'm worried about. And she said to me, mothers and parents, it's rare that they come to a Senko and you're wrong. She said it's rare. So that did make me feel better, because, you know, then you think, actually, it is good that we were able to pick up on these things, rather than thinking, oh no, we'll manage. Because it's okay to say that you're not coping, you're not managing, because you need to learn a different way, a different strategy, so that it suits everyone, so that you're not losing your mind. So that was another big thing, really. What was it? So I concentrated a lot on children with ADHD, but I mentioned about the podcast mum who has later in life been diagnosed with it. So the symptoms in adults are obviously fairly similar, but feeling restless and fidgety, talking a lot and interrupting others, becoming easily distracted, finding it hard to concentrate, and saying or doing things without thinking. So it's talk to somebody, talk to your relative, partner, friends, and speak to your GP and say, you know, just I'm struggling with these things, and they'll be able to refer you to the mental health team that's appropriate for you. So obviously, if it's children and young adolescents, is the CAMS team, and then obviously the older mental health team. So the treatments are medication, so it makes it easier to focus and concentrate. But that's not to say you absolutely have to go down that route. If you're not happy to, that's your choice. And there are other treatments such as therapy, cognitive behavioural therapy, or psychotherapy, and it's about learning ways to manage your behaviours and be able to cope better with daily life, everyday situations. You can have counselling, talking about how it's difficult for you. And then obviously, if you are a teen or still in education, there's educational support specialist help to make it easier for you, and to make them aware as well. I've numbered these sheets, but I'm not following them at all. So sorry about that if it's all coming out a bit gobbledygook. So we've talked about that. So there's self-help ways that you can help yourself as well, which is as an adult, and you can apply some of these to children as well. Obviously, the alcohol and the drug bit isn't, but so alcohol and drugs, it says to limit. Limit screen time and sports in the evening, which again is really appropriate for children. Avoid taking stimulants, medication, or caffeine after 4 p.m. So we have to remember that caffeine is in a lot of things, obviously our energy drinks, chocolate, and tea as well. I think sometimes you can make the mistake of thinking, oh, I won't have a coffee because I want to go to bed, but I might have a cup of tea. But there is caffeine in tea too. So it's about making yourself aware of the ingredients of the things that you're putting in your own body, really. Getting enough sleep, can't stress that enough. And then obviously for yourself, if you are struggling, a big symptom is being unable to switch off at night and settle. So it's a good idea to speak to your GP about that as well, because sleep is, it's a basic need of a human being, isn't it? So, and then obviously eating a healthy, balanced diet as well, which is really important, and that can be applied to children as well, obviously. So that's leads me on to what help is available in the Somerset area, which So we have a directory which Hannah is going to be updating soon, and she's going to post a link for that. And that is the parent carers directory as well. I think that's what you said, wasn't it, Hannah, on the phone? And there is the Pod charity, so that's available for aged 18 to 30, and they're supporting young people and adults with additional needs, young carers and their families. And it helps you find friends and have fun in a safe, welcoming environment. Now, obviously, with us all being in a pandemic at the moment, I would imagine that it isn't running as what it usually is. So, but it is worth going on their website, which is the www.thepodcharity.co.uk, and then you can obviously see what they're doing at the moment, because I'm sure they're doing something virtually, or as we all are, to try and get around the pandemic at the moment. We've got the Somerset Parent Carers Forum. That's what I've confused that with. And ADHD Yeovil support they support families with children who have or are seeking a diagnosis of ADHD. The group is run by parents who have children with ADHD or have ADHD themselves, and so they have a great understanding of the condition. The group is run by Helen, Nikki and Rachel and Sally, and they have the Facebook page as well, which I'm a frequent visitor of. We also have ADHD UK, and they have a self-help screening tool, which I thought was interesting. So ADHD is underdiagnosed. So the World Health Organization and Work Group on Adults with ADHD generated a screener survey. So you can go on that website and take this survey if you're an adult. If you score 4 or above, they recommend that you get in touch with your GP and talk about a possible diagnosis. So yeah, I think that leads nearly to the end of today's Talking Cafe, but I did want to end on something good, which is that so there was a quote that I screenshotted on my phone. I'll try and find it. So, attention deficit disorders may be the spark behind creative geniuses such as Picasso and Kurt Cobain, loads of scientists, but obviously back then it wasn't recognised, so it's difficult to say they did have it. So a professor named Michael Fitzgerald believes people with ADHD have the ability to hyper-focus on things of interest, which makes them excel in what interests them. And that leads me on to well-known people who are flourishing with the ADHD diagnosis. And the first one is the Olympic gold swimmer Michael Phelps, who he was diagnosed with ADHD when he was in 6th grade. But while he couldn't sit through class without fidgeting, he could swim up to 3 hours in the pool after school. And by the age of 10, he was a nationally ranked swimmer. And as we all know, he went on to become an Olympic gold medalist loads of times over. Is phenomenal. Justin Timberlake as well, who's obviously a well-known singer-songwriter and been in films. He's won 9 Grammys, 3 Brit Awards, 7 Billboards, 4 Emmys, and blah, 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 probably loads and loads of other things as well. So he's done all right for himself, hasn't he? Olympic legend Simone Biles, she's won 5 gold medals. I don't know if they were gold, but there were 5 medals in Rio as a gymnast. And she was, I think they tried to get her done for doping, which is why she ended up coming out and saying, actually, I have ADHD, and it's nothing to be ashamed of. And they obviously were able to link back the test results with her ADHD medication. So she ended up coming forward, and she's obviously doing amazing for it, and now is a big advocate for it. And the front man of Maroon 5, Adam Levine, and he's done really well as well. So I do think that it's important to recognise that, if you have a child with ADHD, that's not it for them. It's not, it's they're not their diagnosis, are they? It's about us as their parents learning new ways to get them to engage and get them to reach their full potential, which we're all trying to do as parents for all of our children. With somebody with ADHD, going back to the quote I said at the beginning about somebody with an ADHD mind, it's about getting into that mind, isn't it, and learning how to get them to focus on you. Yeah, so I've done a lot of talking today, but I hope that it has raised awareness and it's been informative. And if you have, symptoms yourself, or you're worried about a child that you have, then, seek help. There's nothing, no one's going to say you're wrong for that. I think, it says more about you as a parent, that actually, you're recognizing that things are just not quite right. Could I have some help to help my child? So yeah, that's it for me today. Don't forget to tune into tomorrow's Talking Cafe, and then obviously they run every day from 11 Monday to Friday. Thanks everyone. Bye.